All right. Well, welcome back to the world of anatomy after a long break. Hopefully, you did not forget everything with chapter 1, or not chapter 1, but the first part of this chapter. And we can always go back and look over um, the old recordings and see um, what you missed. I just graded the quizzes. I just sent them back. So they should be in your email. Do the corrections, send me the whatever. The other thing is that worksheet that I sent out for quiz 1. Um, I got it back from like 3 of you, so take some pictures of it or something and send it back to me, and I'll get those in the grade book as well. I really don't know how much I'm working now over the next month or so just because of this whole corona thing when I'm not able to practice social distancing, so we'll just see what happens here. But in the meantime, we're going to continue to learn the heart. So, um, for those of you that are on, if you have any questions, put them up there on the chat thing there, and I will answer them. But we're going to continue on with the heart here for a little bit. Probably won't be a long lecture today, but we'll get going on some of it. So, um, knowing the flow of the heart, if you did not know or understand the flow of the heart, you probably would reflect in your quiz. Um, so again, it's not super difficult. It's just the fact that it's kind of nice to be able to um, draw it out if you need to. You know, when we're talking about inflow from the superior and inflow from the inferior vena cava into that right atrium through the tricuspid valve into the, wait a second, hold on. Yeah, tricuspid, mitral valve, tricuspid, mitral. Anyway, I got to think about this for a second. Um, but anyway, I'm a little rusty here. Oh my goodness. Let's see what we got. But you guys are all like, he doesn't even know what he's talking about. Lunar valves, atrioventricular, bicuspid. Yeah, tricuspid on the right. Yes, I was right. Yeah, be quiet. All of you guys are whatever. Anyway, so tricuspid, bicuspid, or the mitral. Okay. And so as we have our right atrium goes into the right ventricle through the pulmonary semilunar valve into the pulmonary trunk into the left and the right pulmonary arteries, come back in on the pulmonary veins into the left atrium through the mitral or the bicuspid into the left ventricle through the aortic semilunar into the aorta. Okay? Again, the nice thing about having these things recorded is you can go back and review these. Okay? Test time, you have to understand the flow. There's no getting around it. So, this is where I would say piece of paper, draw it out, and get it done. Okay? So we went through all those different things. We talked about pressures. We talked about how one-way flow of the heart and the valves and all that kind of stuff, and the lub-dub and the AVs and the semilunar valves closing due to pressures. And then we talked about how the heart feeds itself with blood, and it's not that the heart uses blood on the inside. It doesn't. Man, it doesn't. Um, it doesn't absorb blood from the inside. It uses the arteries to get that done. I need some gum or something here to keep myself awake. So, anywho, as we push on, as we continue into this cardiac chapter, we went through the basic structures of what is there. We went through the valves. We went through kind of a little bit of a pressure type stuff. We went through pathways. We talked about all that different stuff. And now we're going to get into this whole electrical portion of the heart. So we know that muscles contract because of electricity, right? They get stimulated and it causes the muscles to contract. All right, and so in order for us to get this timing of this bump, 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 with the top and the bottom, top, bottom, top, bottom, top, bottom, when we get this, when we get to the whole thing of the the atria is contracting, then the ventricles contracting, lub dub, lub dub, top contraction, bottom contraction, top contraction, bottom contraction. In order for us to get that, there has to be some electrical event stuff going on. Okay, so either event can have problems, so doctors need to be able to check each one, right? So either we have the electrical problem or a muscular contraction problem. All right, and generally when they talk about heart issues, they generally talk about everything in terms of ventricular events, right? Something's going on with the ventricle. Okay, so this cardiac muscle needs this organization and rhythm and speed control for maximum efficiency. Okay, so we have two controlling coordinating systems here, right? We want it to rhythmically contract, and we want it to contract faster or slower depending on the body's need, but also we don't want it contracting so fast that the ventricles aren't allowed to fill up completely, because if they don't fill up completely, then that means the ventricles don't eject that much blood. All right, so Clay's here. Do you want to say hi, Clay? Say hi.
Hi.
Okay, anyway, so but anyway, that is one of the issues that we have to do. So we have this coordination of speed and then rhythm and all that kind of stuff. All right, and so the body has done that. All right, so we have two systems here. We have an autonomic nodal system, and we have this autonomic system, and then we have this nodal system. Okay, the autonomic sympathetic increases the heart rate and force of contraction. They're accelerators, right? So we know that sympathetic and parasympathetic, if we remember back a chapter, we talked about sympathetic stuff being fight or flight, meaning someone scares you, jumps out from behind the door and scares you. What happens? Your heart immediately starts beating fast, right? That is sympathetic nervous system that is taking over. Okay, so that's an accelerator. That's going to increase the beat frequency of your heart. Then, when we talked about parasympathetic, when we're just sitting there listening to me lecture, your heart rate tends to decrease and the force of contraction decreases, and so it's kind of like putting on the brakes. Okay? And so we have that whole system, right? The autonomic nervous system that does that. And then we have this nodal. It's an intrinsic conduction system. It coordinates contraction of muscle cells to force blood in the correct pathway. All right, so what we're basically saying there is this. Let me go back up to here. We need this giant muscle to contract in a way that will squeeze the blood from here to here, and then from here to here, right? So like I said, we have a top squeeze and then a bottom squeeze. Top squeeze, bottom squeeze, and the valves don't allow the blood to just go back and forth. It stops the blood and increases pressure and ejects. Okay, so that's where we have that coordination. And so what we're going to learn is some of these nodal system things that we have in the heart. All right, so we have a special tissue that sets the pace. We have gap junctions. All right, this is way back. How many chapters back does this deal with? To where we see cell to cell, where we talked about gap junctions, that cell to cell communication, right? Which is going to be important for us so that we can cause a contraction or a nerve impulse to go, right? So we have gap junctions, right? Cell to cell transmission, muscle cell to muscle cell transmission. Then we have a sinoatrial node. It's a pacemaker all right, located in the wall of the right atria, all right? It initiates a depolarization wave, okay? We will go over some more of this, okay? But just as we're going over this initially, just listen. All right, so we have a pacemaker. The sinoatrial node is what they're going to call the pacemaker. It's in the wall of the right atria, and it initiates a depolarization wave, which means it starts a depolarization wave. It starts an electrical event. Okay? The atrioventricular node, right? So this tells you where this node's going to be, right? The atrioventricular node, so it's down there by the AV valve, is designed to delay the signal momentarily so that the atria have time to fully contract. Okay? So, what this does is, this AV node basically allows a little bit of a delay so that the atria can squeeze a little bit longer, eject all of the blood out of the atria into the ventricle before the ventricle gets stimulated. Okay? So it's just set, just perfect enough to delay the signal so that the ventricle doesn't close too quick and doesn't allow the atria to empty too quick. So let me do this with a visual. Okay? So we're going to have our SA node somewhere in here and our AV node somewhere down here, right? But anyway, we have this electrical vent which is going to spread across this and cause a contraction, causing blood to shoot into the right ventricle. And this is also happening on the left side as well at the same time. But anyway, it's going to go to there, right? Once this electrical event travels and hits the AV node, it's going to stop for just a second before it perpetuates down into the ventricle, allowing this to squeeze a little bit longer, allowing all the blood to get into there, allowing it to get into the ventricle, and then after a short fragment of time, then the ventricle will contract, increase pressure, shut the valve off, enough pressure to open that one up into the pulmonary trunk, into the pulmonary veins. Okay? All right, so we've got that. So we talked about those three things, right? The SA node, the sinoatrial node, it starts this depolarization wave. The AV node delays it so the atria have time to fully contract and empty. Okay? We have an AV bundle and bundle branches, right? It sends the signal down the septum for septal cell excitation, right? And then we have something called Purkinje fibers, which allows electrical signals to penetrate deep into every cell in the ventricular myocardium. Myocardium. All right. So we talked about the AV node, right, which delays the signal from the atria to the ventricle. Then we have a bundle and bundle branches, which is going to take, now, once it's delayed, once it's allowed to pass through the AV node, it's going to hit the AV bundle and bundle branches, send that electrical signal into the septum, hits the Purkinje fibers, and it's going to allow for the electrical signal to penetrate all the muscle cells in the ventricular walls. Okay? So here it is. Okay? We have our sinoatrial node, right? It's going to start a signal in both the left and the right and the left atrium. Okay? This signal is going to travel through the atria, cause a contraction, cause the blood to be forced into the ventricles. That signal is going to hit this AV node, the atrioventricular node. It's going to delay for a split second, allowing the rest of the blood to be shot into there. Then you're just going to hit the bundle branches, the AV bundle and the bundle branches, right? And then hit the Purkinje fibers so that all of these muscles of the ventricular wall contract, causing a nice strong contraction and forcing blood, if it's in the right ventricle, through the right pulmonary valve, into the pulmonary trunk, into the pulmonary veins, to the lungs. Or if we're talking about the left ventricle, through the aortic valve, into the aorta, into the body. All right. So, yes, we have our fight or flight stuff where we get scared, our heart goes bump, 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 bump. It increases. That's an autonomic nervous system thing. It's a sympathetic. And also when we're at chill and we're at rest, it will be a parasympathetic where it calms things down. Then we have internal built-in things that allow for a pace to be set, meaning allows us to get the ba bump, ba bump, ba bump, where we get a slight delay in contraction of the ventricles. All right. So, this conduction system coordinates and synchronizes heart activity for maximum efficiency. All right. Anything that goes wrong with this system will cause a malfunctioning heart. Okay. So, you can imagine if the SA node wasn't depolarizing like it should, meaning it wasn't starting a signal like it should, that would be a problem. All right. Or you can imagine if the AV node did not delay the signal, and so therefore we got a early ventricular contraction, right? We get an early ventricular contraction, which is just not going to allow the atria to empty as well and not these fill up to their full potential, which means yes, the heart is working, but it's not ejecting as much blood as it could be because it wasn't allowed to fill due to this AV node was all messed up. If there was damage to a bundle branch or a Purkinje fiber or whatever it would be, any type of interference in this would be a problem. Okay? So, that's what this is saying. This works, this conduction system, right? Conduction, electricity, right? It synchronizes this heart activity for maximum efficiency. I don't know if this is going to work or not. No. Let me just put this up here real quick and see if we can. Everybody needs a tractor. Just place your tractor. Yeah, there we go. Okay, great.
The cardiac conduction system consists of the following components.
I don't know if you can hear this.
The sinoatrial node, or SA node, located in the right atrium near the entrance of the superior vena cava. This is the natural pacemaker of the heart. It initiates all heartbeat and determines heart rate. Electrical impulses from the SA node spread throughout both atria and stimulate them to contract. The atrioventricular node, or AV node, located on the other side of the right atrium near the AV valve. The AV node serves as electrical gateway to the ventricles. It delays the passage of electrical impulses to the ventricles. This delay is to ensure that the atria have ejected all the blood into the ventricles before the ventricles contract. The AV node receives signals from the SA node and passes them onto the atrioventricular bundle, AV bundle or bundle of His. This bundle is then divided into right and left bundle branches, which conduct the impulses toward the apex of the heart. The signals are then passed onto Purkinje fibers, turning upward and spreading throughout the ventricular myocardium. Electrical activities of the heart can be recorded in the form of electrocardiogram, ECG, or EKG. An ECG is a composite recording of all the action potentials produced by the nodes and the cells of the myocardium. Each wave or segment of the ECG...
All right, so we're going to learn that in a little bit, okay? But you can see here, and you watch that how that delays, that gives a better visual of how that works. And then we'll finish up with just a little bit of this, and you guys can do your review stuff. See how many people are. Is there anybody? There's only a couple people watching. Anyway, so when we talk about contraction and relaxation, we talk about systole and diastole. Okay, contraction and relaxation. All right. So when we talk about doing blood pressures, like 120 over 80. 120 is your contraction pressure and 80 is your relaxation pressure. Okay, so systole is when either the atria or the ventricle will be in contraction, and diastole is when it will be relaxed. Okay. All right, so let's be done with that. So let's be done. It's a short one today. That's fine. That's plenty of stuff for you to kind of wrap your head around. Get your quiz stuff done. Get that review for one done if you haven't turned it in. And then we will go from there. Okay? All right, guys. I hope you guys are feeling well, doing well. And it is just weird times. And but that's okay, because the king is on the throne, and we're not going to worry about it. I miss seeing you guys. I hope you're doing well. Write me a note. Let me know you're doing well. Let me know if you have any questions. Get your quiz stuff done, and we'll go from there. All right? See you later.